welcome to all of you who've joined us today. Thanks for coming. It's great to have you all on this webinar. My name's Ros. I'm Executive Director of Global Clubfoot Initiative, and really pleased to welcome our panelists today, as well as STEPS. So shall we just introduce ourselves? Denise, do you want to introduce yourself first?
Oh, hello, I'm Denise Watson. I'm an advanced practice physio and run a Ponseti service at Chelsea and Westminster Hospital in London.
Thanks, Denise. And Naomi?
Hi, I'm Naomi Davis. I'm an Orthopaedic Surgeon running a busy clubfoot practice at Royal Manchester Children's Hospital.
Fantastic, thank you. And Loredana?
Hi, everybody. I'm Loredana from STEPS Charity Worldwide, and I'm the Managing Director.
Brilliant, thanks everyone. And we've had a few people joining just whilst we introduced ourselves, so you're all very welcome. I'll just talk through again the ways you can interact during this meeting before we get started. So on your control panel on your screen, you should see a Q&A button. If you'd like to ask any questions to the panelists anytime during their talk, you can use that Q&A function to type a question for them. They've got a few questions that have already been sent in by email that they'll answer first, but then we'll look to the Q&A and answer any questions there. And I just wanted to let people know as well that this webinar is organised with STEPS Charity. The primary audience for this webinar today is UK families of children with clubfoot, but I do know that we've got some people from other countries joining us, as well as some clinicians. So you're all really, really welcome. But when we go through the questions at the end, we will pick those that are most relevant to UK families. So I hope that's okay, and we are hoping to provide other opportunities to talk about the international situation more through Global Clubfoot Initiative at a different time. So the first thing we've got to share with you today are a couple of videos of things you can be doing at home. Denise, do you want to just introduce those while I get the video set up for sharing?
Yes, of course. Thanks, Ros. So welcome everyone. We've had a lot of queries about what you can be doing at home with your baby before treatment starts, and obviously for the vast majority of people in the UK with new babies, that they're not getting treatment starting, and so we recorded in clinic yesterday, finishing off our last baby who's just in the very last stages of treatment. He very kindly, his mother let us do some stretches, and so it's just to show you some very basic things that we can do, what you can do with your baby at home. So first of all, I think if Ros is going to run the video, we might have to run it a couple of times. So this is just stimulating the muscles on the outside of the baby's foot. You can see these feet are sort of nearly corrected, but not fully corrected yet. And I'm just tickling the outside of the foot, which is going to stimulate those muscles on the foot that pull the foot up and out. Now, this baby was, and here I'm just showing some stretches. So maybe if we can just go back to the beginning again, Ros. I'll just show the tickling the feet. So either tickling or stroking, and you can see those wrinkles on the outside of the foot appear as he starts to pull the foot up, because he's starting to use those muscles on the outside of the foot that pull the foot up and out. And now I'm just taking the front of the foot. I'm holding the knee very gently, and I'm just going to move the foot. If we've got another video, Ros, of showing the movement, that's the tickling again. And I think we've got another little bit of video showing the actual stretching of the foot, or moving. It's not really so much stretching as just moving the foot and keeping it mobile. I think it's difficult to do a stretch where you hold the position of the foot and feel confident that you're not stretching too much or too little. So actually just gently moving the foot and keeping the ankle joint and the foot joints moving is very important. So I'm just holding the toes, I'm holding the knee still, and I'm moving the foot in and out, like a bit like a sort of a windscreen wiper sort of movement across the foot. And you can see just at the ankle joint, and I'm stretching that sort of inside arch of the foot, but it's very gentle. You can see I've got very gentle fingers. Maybe you can just run that once again. So I don't think there's a place for sort of doing hard pushing stretches at all. It's just gentle movement. And then holding for a few seconds at the end, depending on what the baby's doing. This baby was kicking around at this stage, so I didn't really want to make him uncomfortable. And I'm just moving very gently backwards and forwards. And that really is all that you need to do to just keep the foot moving, and maybe some gentle massage on the foot, just so that the baby's used to having their foot held and touched and manipulated. And then that's going to make our job much easier as the baby gets bigger.
Great, thank you very much. Would you recommend?
Are there any questions? If anybody's got any questions about those, please just put them in the Q&A section. Sorry.
Yeah, thank you. And then either Denise or Naomi, I think one of you was going to talk us through the situations in which a family might need to take off a cast at home, and how they could do it if that was what they needed to do.
That would be helpful. Thanks, Roz. So I think the situations when this might occur, and we very much hope that it won't, but if you as a family need to self-isolate for any reason and therefore you can't bring your baby down to the clinic, or if the clinic has to stop completely, and it's difficult to know what's going on around the country at the moment, but we know this is a rapidly changing situation and this may happen at some point. This is all to do with the capacity for the hospitals to be able to deal with any outpatients at all. And although, and I've said this before, although we think clubfoot is the most important thing in the world in the treatment, people don't agree with us. And there are other conditions that they regard as more urgent. So I'm sorry for that. This applies to plaster of Paris. If you have any other sort of cast on, if it's a soft cast, by nature of the fact that it is soft, you can usually unwind it. If it's fiberglass but not a soft cast, then there's no way to get it off other than by using something like a plaster saw or some very strong scissors, and I would strongly urge that you get help with that. In terms of plaster of Paris, they all eventually soften in water. So there are two ways to do that. Number one, in a bath, or number two, by soaking them, and we do that by, you start in the bath anyway, get your baby in a nice warm bath, make sure the plaster cast is well covered with water, let it go a little bit soft and give it a little bit of a squeeze, and that helps the water get through the layers of the plaster. And then you can either leave them in the bath until it gets really, really soggy and it looks really obvious that you're going to be able to take that off yourself, or when it's just gone that little bit softer, you can just take your baby out, wrap another wet towel around it, and then some cling film to keep it wet, and let that soak for, how long would you say?
Half an hour.
About half an hour or so, and then you'll find the water has seeped through the whole of the cast and it should be relatively easy to take off. Sometimes if your practitioner's left a little nubbin of plaster for you to unwind, you can take that nubbin and unwind it as a whole roll. If you're going to try and cut through it, then that would need to be carefully with scissors with blunt tips on them. And I think, as bizarrely I said before, there are dog toenail clippers are actually very sharp, but also designed not to have a very flat end to them, so that you can very safely get those around the plaster. And that was some advice from one of my patients from many years ago. They use that. Obviously clean them first. So I'm sure you'll find your ways of doing it, but that plaster will go soft eventually. Any questions about that for anybody?
I don't think there are questions at the moment. Should we then cover the questions we have received so far from families here in the UK? Would that be okay, Denise and Naomi?
Yes, lovely.
Okay, perfect. So the first question we have received from a mother who just had her 20-week scan. Basically said that her child has been diagnosed with clubfoot. She would like to run more tests to ensure that there is no other condition present, but unfortunately she's unable to do so. She would like to understand that if it's common to have clubfoot as the only conditions.
Okay. I think this is a very difficult area, and it's not our area of expertise, just to be clear. We do the treatment of clubfoot, but the diagnosis, the prenatal diagnosis, is another area. We used to be able to get some advice on this. We used to say that if it was unilateral, it was less likely that there was another underlying condition associated with it. But some recent work, and I'm not up to date with all the prenatal stuff because it actually goes into different journals from the ones that we read. So we read orthopaedic and physiotherapy journals, and this is stuff appearing in journals from antenatal services. So all I can really say is that you need to get in touch with your local antenatal team to ask those questions. I'm sure they'll be happy to talk to you on the phone about it, but the absolute risk one way or the other, I'm unable to comment on that, and I'm sorry.
Okay, thank you, Naomi. With regards to getting access to the consultants, we had few families that at the moment they said they're finding it a bit difficult to getting through to them, and would like to understand if they can't get through to them and something is wrong with the boot, so they have the child has sore feet. What should they do?
Okay, so I think you need to know that the advice that's gone out from the UK Clubfoot Consensus Group and from the British Society of Children's Orthopaedic Surgery is that we set up remote details for this, so that you should, if you haven't already, be getting some information through, or your hospital should have some information on how to get in touch with them. It can be challenging at this time. Staff levels are reduced. It doesn't mean to say nobody will answer the phone. It just means that it might be later rather than sooner. And as I say again, they're dealing with some different priorities at the moment, so it may take some time to get back to you. But we would expect most services to have someone that will be in touch with you at some point. Certainly everybody in the UK Clubfoot Consensus Group does have, so I'd expect that to be available. So keep trying would be, without driving yourself mad with it, but keep trying.
Thank you. With regards to appointments in April and May, we are receiving a lot of questions with regards to whether these appointments that are now in late April or beginning of May will be postponed. Is there anything that you can say with regards to those that have an appointment? Should they contact their consultants to find out?
No, I think so. I think it's fair to say those appointments will be cancelled. Certainly through April, we've cancelled through to the end of June, and I think it's going to go towards the end of July. And it's not just about how active the hospitals are in dealing with the patients that are suffering from COVID-19 at the moment. It's actually more to do with the backlog that then is created from the busyness that we have now. But every hospital will have a process for getting in touch with you. You've probably already received a letter or a text or some contact saying that your appointment has been cancelled, and that should mean that there behind that contact is a process that says that you are now you will be on a waiting list to have contact made again when we start opening services again.
Yeah, I mean, exactly. We just don't know at this point, and every service is going to have slightly different demands when we do come out the other side. So, I mean, I know certainly my service, we're keeping a list, and we'll have prioritise the patients according to their need when we do start treating patients again. And we may have to completely rejig the way we do our clinics in order to cope with that need. So I think I agree with Naomi. April and May, it's very, very unlikely. We're certainly cancelling our clinics for those months, and we're hoping to be able to see patients in June, but we just don't know. We can't. It's changing day by day, week by week.
Thank you, Denise. With regards to families that have not started the treatment, we received a query whereby this mum said she's come to terms with the fact that her baby will not receive the treatment, but she's wondering if there's anything she can do at this point in time to help the baby, and she's worried if the condition can't get worse if nothing is done.
Naomi, are you happy for me to?
Yeah, go for it.
Okay, so I think the most important thing is don't try another treatment. Don't try another treatment. The massaging the legs, stretching, those very, very gentle stretching movements and tickling, that's really all you need to do. It's going to be much easier to treat these feet in a few months' time if that's all you've done. You don't want to be trying other different types of treatment like taping or strapping or different types of splints, just wait and enjoy your baby, and enjoy having time when your baby's not in plaster, because you've got that opportunity, and it will be much easier for us to treat the feet later.
It's interesting, actually, isn't it? Because I think that early babyhood is lost sometime in the plasters, and so you may think that you're losing a little bit in terms of treatment, but you're gaining a lot of time when your baby can still have a bath. I think people find when they come out of the end of plaster treatment that suddenly, they've lost that moment. So you've regained that moment and make the most of it.
Yeah.
Thank you. And the last question that I have is related to older children, especially those that for whatever reason they're not in boots and bars at the moment, whether it's because they had sore feet. Question that we received is, how do I know whether the feet are relapsing? What are the key signs?
Okay, so it's difficult. It depends. It's not difficult, but it depends a little bit on what age they are. But in general, you see the signs come back in the reverse order to the way they were corrected. So sometimes the first thing that you see is that the foot doesn't come up as far, that you see the crease appear on the inside of the foot again, and generally that it starts to feel stiffer. That's in children who aren't walking. In children who are walking, you may see that they turn their feet in a little more, that they walk on the outside of their foot more, and they wear their shoes down on the outside more than they do the rest of the sole of their shoes. So those are some simple things that you see.
And one other sign might be that you may find that it's just becoming more difficult to get the heel right down into the boots, and you notice that the foot isn't quite as flexible at the ankle. So that might be another way. And again, we'd urge you to be in contact with your local teams. They may be able to take some phone calls, but they're not going to be able to treat that at the moment. And again, that would be something that would go onto a priority list to look at as soon as we're able to do face-to-face communications again.
Okay, thank you very much. That was from my side in terms of the questions I have received so far. Rose, do you want to cover the questions that we're receiving online?
Yeah, sure.
Thank you.
So one question that came in before this webinar was that if people are advised to take the cast off at home because they can't come back into the hospital, will that cause a relapse of the foot? And I know you covered this a bit last week, but just for anyone who's new today, will that cause a relapse of the foot? And if it does, how would that be treated?
Okay, so sometimes you get them just going back a stage or a little bit, a stage or two to where they were before the last cast. But it's weird, and I don't know why it happens necessarily, but they tend not to turn, they don't go all the way back, so they don't become as bad as they were when we first started treating them. Which is a nice thing, and we would expect to be able to resolve that when we're open again for business. We'd expect to be able to fully resolve that, and I think I'm happy to repeat this, that we know treatment can be effective well into the first year and beyond, it takes some attention to detail when we come back to treating those, but it's all entirely possible, and we expect to be able to get full correction again.
Yeah. There are other reasons why sometimes both of us have had to take casts off and start again. So things like, if a child develops an illness, or if they've had a skin condition that's a problem. So you'll find that all of the clubfoot centres will have addressed this problem in a maybe slightly shorter time frame. So there are other reasons why casts need to come off and things need to be restarted.
And don't forget, we have babies that aren't immediately well when they're first born, that have treatment delayed for months, and we still get them through it. So yeah, there's a lot of reasons why we delay it. We don't like any of them, but we can manage those.
Thanks very much. So this is my final question from email or from the Q&A at the moment. So just if you're a participant and you have a burning question, please ask it now. This question came in by email. It's actually about a specific case, but I'll try and make it kind of generalizable to our audience. So this is about someone who had a tendon transfer 5 years ago. and has also had a few tenotomies, had 3 tenotomies, and is now looking as though he's beginning to relapse again. What's your advice at this point around delaying casting? And their specific question is around whether delaying will risk developing tibial torsion.
No, there's no evidence that tibial torsion would be created by delaying at this point. In fact, there's any time anybody's looked at tibial torsion, because people worry about tibial torsion a lot with the boots and bars, there's the opposite is true, and in fact there's no evidence that they cause tibial torsion at all. I think tibial torsion can be misinterpreted when people look at the foot sometimes. It's difficult when, when we can't look at a patient now, so we can't say what the issues are. But no, tibial torsion wouldn't be one of the things that we worried about. But obviously, if there's an increasing problem, then the child will need to be seen as soon as we open up again.
I think it's worth saying this is hugely frustrating for all of us not being able to treat, and I think there wouldn't be a professional in the country that doesn't want to get back to treating your children as soon as possible, and it's not an ideal situation, but the risks of COVID-19 are too great to be able to treat children at the moment.
Okay, thank you. We've had one more question on the Q&A about a child that's undergone casting and tenotomy, and he's been started in a foot abduction brace, but the family are finding he's very uncomfortable and is crying a lot, and they're not able to see a doctor at the moment due to the lockdown situation. What help or what guidance would you give in this situation?
Would their team that are treating be able to organise a video call? That might be something that's worth asking about, whether it's possible to have a video call, because you may be able to sort out quite a lot of the problems by actually seeing the foot. If that's not possible, then photographs sent through to email, or if there's or texted to a work phone, may be a way of moving forward. But I think liaising with the service that's fitted the boots and bar is essential. Any other suggestions, Naomi?
Well, I mean, they're just general suggestions. We know babies get upset when boots and bars are first fitted. It's important to check everything is correct, so that the foot is corrected, that the boots and bars are at the right distance apart, that the straps are snug, and the heel is well down, so that they're not rubbing, because it's really common to leave them a little bit loose if a baby becomes uncomfortable, because you think that's more comfortable for them, but in fact the opposite is true. You get blisters from the rubbing if you've got some movement in the boot. So all of that needs to be checked, ideally by your treating clinician, and check that the skin looks okay. But it is really common for babies to be upset about this sort of thing. And we also know that we fit the boots and bars at a point at which babies are reaching their peak of crying, which isn't ideal. And we've tried to look at ways of maybe not doing that. So every baby cries, and every baby has a curve of starting off as not quite so crying and then getting higher, usually around about the point at which we fit the boots and bars, whether we fit the boots and bars or not, and then comes down the other side. So it's common for that peak and the boots and bars to coincide, and for you to think that the boots are uncomfortable, but in fact it's not. It's just that natural progression of the amount of crying during the day that a baby normally does. It's difficult for me to reassure you because you're not my patient, or if you are, then get in touch and I will reassure you personally. That's the sort of advice we tend to give, and we've looked at. We don't want to leave it later if we don't have to, and we can't treat any earlier because the baby's not born yet. So we tend to hit that natural peak in crying that babies have, that then people associate with the boots and bars. And I'm sorry for that, but persisting with them as long as everything else is okay. So as long as everything fits all right and the foot's nicely down and everything's nice and snug, persisting is worth it, and you come out of that period.
Thank you. So another question has come in, and I think for this one there might be two different answers depending on whether braces are available to be sent through the post. But someone's asking what can be done if the braces are broken or damaged during this time. Any thoughts on that?
So as far as I know, a lot of the companies have agreed to send the braces to the family's home. And if not, some centres are running a sort of drive-in facility. I'm not quite sure how they're doing that, but I think probably it's something to do with notifying them when you're going to be there and a package being left for you to pick up and take away. So a lot of companies are doing that, and I think just inquire with your team as to what arrangement they've got set up.
And then there is good, there's good information online on some of the companies' websites on how to set up the angle if it's not quite right, or how to tighten screws and how to fit the boots. So there, it's worth looking at the individual make of boot you're on, see what the companies who've distributing them, what they've got on their website, because there's quite a lot of fitting information and setup information on the websites. Loredana, I'm wondering whether there's some scope for buddying with parents. I mean, there may be other parents out there through some of the Facebook pages that have already been through all of these issues, which are actually nothing to do with COVID-19. They're just the issues which one has with babies in boots, and using other parents on Facebook to help you with your questions, because there are many parents on the Facebook groups who are doing really, really well in their boots and bars, who don't really post very much because they don't feel they've got many problems, but would actually be really, really helpful in supporting parents that are finding it difficult.
Yes, indeed. And we have a lot of volunteers at the moment that are ready to support families. So for families that are finding it a bit difficult, you can contact STEPS, and we can put you through those volunteers that are happy to help you over the phone or online. We're also developing different videos at the moment to support you through this phase if you can't go and see your health professional. So there's a lot that can be done, and usually then at the end of the video of this webinar, we provide all of the necessary information for families to be able to connect. We can't connect physically, but we definitely can connect virtually online. And I think I do encourage all the families to support each other through this COVID-19 pandemic, because as you say, these usually are common problems for families with or without the pandemic, and definitely there are a lot of tips out there that we can provide. And also we have the interactive video that we parents can go and view, where we have basically compiled the key questions that families tend to ask when you go through treatment of clubfoot, and these questions are still valid, as you say, even during the pandemic. I have one question here that I've received from a family with regards to relapse of an older child. What can be done? I mean, is there anything that they should be doing, like stretches or any activity that they should tell their child not to do?
Can't think of anything. Well, in general, what shouldn't they do? Jump on a trampoline and try and break something, but that's a completely different conversation. Just putting it out there. Keeping them active is important, actually, and keeping their muscles strong is something we would recommend. The simple things I teach in my clinic are the standing on one leg to keep that coordination and that balance, and the other one is some stretches that I think, have we given you details of the stretches that we're talking about? We maybe should be able to post those as well. So simple stretches that aren't going to annoy a child during the day when you insist that they do them, but I often get my kids to do them while they're cleaning their teeth, so that they're doing two things at once and it's not taking up the rest of their time and interfering with any fun that they want to have through their virtual holidays.
Thank you.
Is there something else that you would want to say about that?
If there is some appetite for this, I think we've talked about maybe doing another webinar in a few weeks' time on actually showing some of the stretches. We'll have some willing willing volunteers, i.e. Ros's children, to demonstrate some of the stretches so that just people can see them actually physically being done if possible. So we're working on that if there's an appetite for that.
That would be good.
Yeah, that would be great. Yeah, brilliant.
I think there are a couple of other questions. I don't know whether.
Go ahead, Loredana. Yeah.
Sorry, I'm just reading it now. I think they're again related to what do they do if they can't, with the braces. Sorry, if obviously they need to change the braces because they're too small. I think that was already answered depending on where you are in.
Yes, but I think too small is slightly different in this situation as well, that if the toes are coming a little bit over the end of the boot, I wouldn't worry about it too much. So don't get too stressed about that if they're just sort of over the end, because they'll still be fine. If they're not wide enough, it's a different matter, but the length is less important over this period.
Okay. I think that's it from our side. Yes, should we? Okay.
Yeah,
and
probably.
Thank you very much indeed.
Yeah, we've had a message from CPRO Direct about answering the question of the breakages as well, that they're happy to drop ship a replacement to families at home. If the hospital informs them of any breakage, they'll be happy to send out a replacement. And then the last couple of questions that came in were around what to do if babies can't get to the clinic for the braces. And I think we've covered those, but I think we've covered them for the UK situation, but those might be coming in from international participants. Please get in touch with me if you're an international participant. We're holding some meetings for this through GCI on a different forum, and we'll talk about those issues there. And then the final thing to say is that a few people have asked for the videos to be shared. We'll talk about whether we can share them after this, and if so, we'll let you know via our social media and also our webinar mailing list. So please make sure you're on those to receive notification if we're able to share them, and we'll also share those resources that have been published via Viscos from the UK Clubfoot Consensus Group as well on our social media. So please look out there for those things. But thank you all for joining us so much today. Any final messages from you, Loredana, or Denise or Naomi before we end?
Keep safe, everyone. Keep safe.
Keep safe, keep calm, and don't panic.
Indeed.
This can be sorted out.
And we're here if you need any help. We're still here 24/7 with all our volunteers to support you through this difficult phase.
Brilliant. Thank you so much. We're going to end now. We'll let you know when we organise another one. Thank you all for joining. Bye-bye for now.
Thank you.
Bye-bye.
Bye.